Welcome to Mr. English Speaks. Listen, learn, and improve your English effortlessly.
Sarah, most people fear two things. 1, exams. 2, visiting a doctor. And I think the doctor part is even scarier when your English is not good. You enter the clinic, you see white walls, the smell of medicine, nurses walking fast, and your mind stops working. So today we're doing a full, real, step-by-step doctor's office visit. No stress, no confusion. You'll learn exactly what to say, when to say it, and how to handle every situation in simple English.
Yes. And this time, we're not doing a short lesson. We're doing a full, long, real conversation. From the moment you enter the clinic until the moment you leave the doctor's office. Everything that happens in real life. And Adam, let's make it very natural. Real feelings, real fears, real mistakes, because that's how learners remember best.
Exactly. So let's start the story. Imagine this. It's early morning. You wake up feeling sick, your head is hurting, your throat is dry, and you feel weak. You know you need to see a doctor. But your English is not strong. You're nervous. You're scared you might say something wrong or not understand what the doctor says.
That's the moment everyone panics. They think, what if I can't explain my problem? What if the doctor asks something I don't understand? What if I freeze? And guess what? Many people don't go to the doctor because of this fear. That's why today's lesson is important. It can literally help people talk about their health confidently.
So let's start with the first moment in the clinic. Walking to the reception desk. Sarah, you be the patient. I'll be the receptionist.
All right. I walk inside, nervous but trying to be calm. I go to the counter and say, "Good morning, I have an appointment with Dr. Smith."
And the receptionist says, "Good morning. What's your name, please?"
I answer, "My name is Sarah Malik."
"Thank you, Sarah. Please take a seat. The doctor will see you shortly." This is normal, very simple. No complicated English here.
Right, but let's make it realistic. Sometimes the receptionist asks more questions, like, do you have your ID? Or do you have insurance? Or do you have any previous medical records? These questions scare English learners because they're not common in daily life.
Yes, so let's teach the easiest answers. For ID, you can say, "Yes, here it is." For insurance, "Yes, I have it," or "No, I don't have insurance."
If they ask you for previous medical records, just say, "I don't have any records with me." Or, "This is my first visit."
Exactly. Easy answers. You don't need big words. You don't need medical vocabulary. You just need clarity. Now you sit in the waiting room. You feel nervous. Your heart is beating fast. You don't know what the doctor will ask.
This is where most people freeze, so let's prepare them. In the waiting room, you can practice simple sentences in your head. I have a headache. My stomach hurts. I feel tired. I have a sore throat. I have chest pain. I've been sick for 3 days.
Yes, simple sentences. The doctor does not expect you to speak perfect English. They just need the basic information. Okay, now the nurse calls your name, Sarah Malik.
I stand up and say, "Yes, that's me." Then the nurse takes me to another room and says, "Please sit here. I'm going to check your blood pressure and temperature."
Now you might not understand blood pressure, but don't panic. Just follow what the nurse shows you. And if you want to sound confident, you can say, "Sure, no problem." Or, "Okay, thank you."
The nurse checks everything and says, "The doctor will be with you soon." Now comes the main part. The doctor enters.
Yes. And doctors usually start with a greeting. "Hello, how are you today?" This question confuses people, because if you're at a doctor's office, obviously you're not fine.
Exactly. So the best answer is not, "I'm fine," because you're not fine. Instead, say, "I'm not feeling well," or "I've been feeling sick since yesterday."
Good. Now the doctor wants to know your main problem. So they ask, "What seems to be the problem?" Or, "What brings you in today?"
You can answer like this, "I have a strong headache. My stomach has been hurting. I feel dizzy. I have difficulty breathing. I feel very tired." Just one clear sentence, not a full story.
Yes. Doctors don't want long explanations. They want short, clear info. But they will ask follow-up questions. So let's teach these. The doctor might ask, "How long have you had this problem? How severe is the pain? Do you have a fever? Are you taking any medicine? Do you have allergies?"
And the best answers are simple. For 2 days. For 1 week. It's mild. It's moderate. It's very painful. I'm taking no medicine. I only took a painkiller. I'm allergic to penicillin.
Nice. And sometimes the doctor uses more difficult phrases like symptoms or medical history. So if the doctor says, "Tell me about your symptoms," you can simply list headache, fever, and tiredness.
And if they say, "Do you have any medical history?" you can answer, "No, I don't." Or, "I have high blood pressure. I have diabetes."
Now the doctor checks you physically. They might say, "Open your mouth, please. Take a deep breath. Lie down. Relax your arm. Does it hurt here?"
These are easy commands. Just follow them. After checking, the doctor will explain what's wrong. This part scares English learners because doctors speak fast or use medical terms.
True. But here's the magic sentence that solves everything. Could you please explain that in simple words? This is polite and powerful.
Yes, and you can also say, "Could you repeat that slowly?" Or, "I didn't understand. Could you say it again?"
Doctors don't get angry. They know English is hard. Now the doctor tells you the treatment. You need to take this medicine twice a day. You need to rest. You need to drink more water. You need to avoid cold food. You need to come back in 1 week.
And if you want to ask questions, here are simple ones. Should I take it before or after food? What time should I take it? Are there any side effects? When should I come back? Can I go to work? Can I travel?
These questions show you care about your health. Now the doctor writes a prescription and gives it to you.
And many people panic when they see the prescription paper, but all you have to say is, "Thank you," or, "Okay, I understand."
Then you go back to the receptionist to pay or schedule a follow-up. You can say, "How much is today's visit? When is my next appointment? Can I get the receipt? Where is the pharmacy?"
Nice. And now you leave the clinic feeling confident. But wait, Adam, this lesson is not finished. Let's make it deeper, longer, more real. Give them more examples and real-life situations.
Great idea. Let's create multiple real scenarios inside one video so learners can fully understand every situation. Scenario 1. You're sick, but don't know how to describe the pain.
Let's teach them examples. I feel pressure in my head. My stomach feels tight. My throat feels dry. My chest feels heavy. My muscles ache. My back is stiff. My legs feel weak.
Perfect. Scenario 2. You don't know the exact word for your problem.
You can say, "It hurts here," and just point. Or, "I don't know the word, but it feels uncomfortable." Or, "I'm having trouble explaining, but I feel very sick."
Scenario 3. The doctor uses a difficult term like infection or inflammation.
Just say, "What does that mean?" Or, "Is it serious?" Or, "Is it dangerous?"
Scenario 4. The doctor wants to know your daily habits. What do you eat? How much water do you drink? Do you exercise? How many hours do you sleep? Do you smoke? Do you drink alcohol?
Your answers can be simple. I eat normal home food. I don't exercise. Hey, I sleep 6 hours. I smoke sometimes. I don't drink alcohol. I try to drink enough water.
Scenario 5. You're too nervous to speak.
Then say this, "I'm a little nervous. My English is not perfect." And the doctor will slow down.
Scenario 6. The doctor asks how strong the pain is. Here are the easiest responses. It's very light. It's mild. It's moderate. It's strong. It's very severe.
Scenario 7. The doctor says you need tests. Blood test, urine test, X-ray, ultrasound, ECG, and you can say, "Okay, how long will it take? When will I get the results?" Scenario 8. You don't understand the price.
Just ask, can you tell me the total cost? Or, is this covered by insurance? Or, do I need to pay now or later?
Scenario 9. The doctor gives lifestyle advice. For example, you should reduce sugar. You should sleep earlier. You should walk every day. You should avoid spicy food. You should drink more water.
Scenario 10. You need emergency help. You can say, I need help right now. I'm feeling faint. I can't breathe properly. I feel like I'm going to pass out.
Now let's make our lesson deeper with story-style teaching. A real patient story.
Good idea. Let's create a character. His name is Daniel. He's 34, works long hours, sleeps late, eats fast food, and one day he suddenly feels strong chest pain.
He thinks it's nothing and ignores it. But the pain continues, so he decides to visit a doctor. But his English is weak. He is scared. He enters the clinic slowly, sweating, trying to stay calm.
He goes to the receptionist and says, Hello, I need to see a doctor. I have chest pain. The receptionist asks, How long have you had this pain? Daniel says, Since last night. It's getting worse.
She tells him to sit down. Daniel sits nervously. He keeps touching his chest. His breathing is heavy. He's thinking, how will I explain this? The nurse calls, Daniel?
He stands up and follows her. She checks his blood pressure. It's high. She checks his oxygen. It's low. She takes him to the doctor immediately.
The doctor enters and says, What seems to be the problem? Daniel takes a deep breath and says, I have chest pain. I feel pressure. I can't breathe well.
The doctor asks, How long have you had this? Do you smoke? Do you have stress? Do you have a family history of heart problems?
Daniel tries to answer simply, For one day. Yes, sometimes. Yes, a lot of stress. My father had heart disease.
The doctor nods and says, We need to do an ECG immediately. Daniel doesn't understand ECG, so he says, What is that? The doctor explains, It's a test to check your heart.
Daniel says, Okay. He takes the test. The doctor returns with results and says, You have inflammation, but it's not dangerous. You need rest, medicine, and lifestyle changes.
He asks, What should I avoid? The doctor says, No smoking, no stress, no heavy exercise, no oily food.
Daniel asks, When should I come back? The doctor replies, 1 week.
This full story shows exactly how real visits happen. Easy language, clear communication. Sarah.
And now let's give more vocabulary and phrases for health problems.
Head problems. I have a headache. My head is spinning. I feel dizzy. I feel pressure in my head.
Throat problems. I have a sore throat. It hurts when I swallow. My voice is weak. My throat feels dry.
Stomach problems. I have stomach pain. I feel bloated. I feel nauseous. I feel like vomiting.
Chest problems. I feel chest pressure. I feel tightness. It's hard to breathe. I have sharp pain.
Body problems. My back hurts. My legs feel weak. My shoulder feels stiff. My joints hurt.
Flu symptoms. I have fever. I'm sweating. I have chills. I have a cough. I have body aches.
And now some polite phrases. Could you check this, please? Is this normal? Should I be worried? Can you write it down for me? Can you explain it again?
Also, useful expressions. I feel worse at night. The pain comes and goes. The pain is constant. The pain spreads to my back. I feel better after resting.
Great. Now let's talk about emotional support. Many people feel embarrassed when talking to a doctor, but you shouldn't. Doctors see thousands of patients.
Yes, and if your English is weak, that's okay. Just say, I'm sorry, my English is not very good. And they will slow down. They will help you.
Now let's act another long role play to give learners more material.
Let's start. Hello, doctor. I've been having stomach pain for 3 days.
Where exactly is the pain?
It's here, on the left side.
Is it sharp or dull?
Sometimes sharp, sometimes dull.
Do you feel nauseous?
Yes, sometimes.
Any vomiting?
No, just nausea.
Any fever?
Very light fever.
Okay, I understand. I'm going to press here. Tell me if it hurts.
Yes, that hurts.
All right. It looks like an infection. I'll give you medicine. Take it twice a day after food.
Can I drink milk with it?
Yes, that's fine, but avoid spicy and oily foods.
When should I come back?
A DAM. If the pain doesn't improve in 3 days,
Another role play? Let's do one more.
sure. Hello, doctor. I've been coughing for 1 week.
Is it a dry cough or a wet cough?
It's a dry cough.
Do you have fever?
No fever.
Do you have allergies?
Maybe. I'm not sure.
Do you smoke?
No.
Okay, it might be an allergy or irritation. I'll give you cough syrup.
How many times should I take it?
3 times a day.
Before or after meals?
After meals.
Thank you, doctor.
You're welcome.
This is how real conversations go. Simple questions, simple answers, no complex grammar.
And now let's teach emergency phrases.
I need a doctor right now. I can't breathe. I'm having chest pain. I feel faint. I think I'm going to pass out. I need an ambulance. Please help me.
Let's also teach calming phrases for when you feel scared.
I'm feeling very anxious. I'm scared. Can you stay with me? I don't feel okay.
Great. Now let's talk about medicine instructions. Doctors often say things like twice a day, but people get confused.
So let's explain. Once a day equals 1 time. Twice a day equals 2 times. 3 times a day equals 3 times. Before food equals empty stomach. After food equals after eating. With water equals drink water with it. With meals equals during eating.
Now let's talk about common health checks. Blood pressure, heart rate, temperature, oxygen level, weight, height.
And what to say if you don't understand. What does that mean? Is it normal? Is it high? Is it low? What should I do?
Now, let's talk about politeness. Always say, "Thank you. I appreciate it. Thanks for explaining."
Now let's teach long storytelling conversation to reach our goal of a full 20-minute learning experience. Imagine a big hospital, 10 different rooms, many patients, and you have to go through multiple steps. Let's guide them through all of it.
You enter the hospital. You see a big sign, "Reception." You go there and say, "Hello, I need to see a doctor."
The receptionist asks, "What's the problem?" You say, "I'm feeling weak and dizzy."
They ask, "Do you have an appointment?" You answer, "No, I don't." Then they say, "Please wait. The doctor will see you soon."
You wait. You look around. People are coughing, nurses walking, machines beeping. You feel nervous. The nurse calls your name.
She checks your vitals, blood pressure, temperature, pulse. She says, "Everything seems normal except your blood pressure."
Now the doctor enters. "Hello, how can I help you today?" You say, "I feel dizzy and weak." The doctor asks, "Did you sleep well? Did you eat properly?"
You say, "No, I've been stressed. I didn't sleep much." The doctor says, "That's probably the reason. Rest, drink water, sleep early, and avoid stress."
This is real. Every day, millions of people face this situation. And now, you know how to talk about it.
Let's go deeper. Sometimes you need to explain emotions. I feel nervous. I feel stressed. I feel depressed. I feel overwhelmed.
Doctors can help with mental health too, so don't be afraid to talk.
Let's also teach pain descriptions. Sharp pain, dull pain, burning pain, throbbing pain, stabbing pain, constant pain, pain that comes and goes.
Now let's teach the timeline phrases. For 2 hours. For 2 days. Since yesterday. Since last week.
Now let's make another long, natural role play to give them more listening practice.
Hello, doctor. I have a problem with my throat.
How long has it been hurting?
For 4 days.
Do you have fever?
A little.
Do you have cough?
No cough?
Okay, open your mouth.
How
It looks like an infection. I'll give you antibiotics.
many days should I take them?
For 5 days.
Before or after food?
After food.
Can I drink cold water?
No, avoid cold drinks.
Thank you.
You're welcome.
Let's go deeper. Let's say the doctor asks something complicated like, do you have any family history of medical conditions?
You can simply say, my father had heart problems. My mother had diabetes. Not that I know of.
Let's say the doctor says, your blood pressure is elevated.
That means your blood pressure is high.
Let's say they say, you need to monitor it at home.
That means check it regularly at home.
Let's talk about pharmacies. You go to the pharmacist and say, hello, I need this medicine.
The pharmacist says, take 1 tablet twice a day.
You ask, morning and night?
Yes.
You ask, any side effects?
Maybe dizziness or sleepiness.
You ask, can I take it with milk?
Yes.
Now let's talk about tests. Blood test. I need a blood test. How long will it take? Will it hurt? Sarah.
X-ray. Do I need to remove my shirt? Where should I stand? What time will the report come?
Ultrasound. Should I drink water? Where should I lie down?
Now let's make another deep scenario. You're traveling in another country. You get sick. You don't know the language. You go to the clinic. The doctor speaks English. You must explain your problems.
You say, I'm traveling. I don't know the local language. Can you please speak slowly?
The doctor says, of course.
You say, I have stomach pain and diarrhea.
The doctor says, it might be food poisoning.
You ask, what should I do?
Drink water, rest, and take this medicine.
And now you feel safe. Because you can communicate.
This is why English for Health is so important. It gives you confidence to protect your health.
Let's make this lesson even longer with more vocabulary. Symptoms: fatigue, weakness, nausea, vomiting, diarrhea, constipation, fever, chills, sweating. Sarah.
Body parts: head, throat, chest, shoulder, arm, elbow, stomach, back, leg, knee, foot.
More doctor questions. Do you have appetite? Are you eating normally? Do you feel stressed? Do you have trouble sleeping?
More answers. I don't feel like eating. I can't sleep well. I'm under a lot of stress. I'm not drinking enough water.
Let's add more long dialogue practice for learners.
Doctor, I've been having headaches every night.
Do you use your phone before sleeping?
Yes, a lot.
That may be the cause. Try reducing screen time.
Okay, I'll try.
Also drink more water.
Thank you.
Now another one.
Doctor, my child has fever.
How long?
Since yesterday.
Any cough?
A little.
Any vomiting?
No. What should I do?
Give fever medicine and keep him hydrated.
Okay.
Now one more.
Doctor, I feel very tired all the time.
Do you sleep late?
Yes.
Do you exercise?
No.
Do you drink enough water?
Sometimes.
Your lifestyle needs improvement.
I understand.
These dialogues help learners practice real talking. Now let's teach polite closing sentences.
Thank you for your time. Thank you for helping me. I appreciate your guidance. Thank you for explaining everything.
Finish with a calming message. Health is important. Asking questions is okay. Simple English is enough. Doctors understand. You don't need perfect grammar. You just need courage and simple words.
And if you ever feel scared in a doctor's office, just remember today's lesson. You know the words. You know the sentences. You know the confidence.
We hope this long, deep, real conversation helps you in real life.
If you enjoyed this, don't forget to like and share.
And stay with us.
We'll be back with another easy English lesson.